you?
Good, how are you?
Good. I'm back. You know, I'm Heather, and I brought a nursing student, Corrine, with me.
Hi, Miss Yarn. Hello.
Okay. We're going to be giving you your IV fluids, your sodium chloride with potassium,
Okay.
and your gentamicin, which is your antibiotic, okay?
Okay.
All right. So first we want to check our medicine.
Okay.
Make sure it's clear, it's not expired. We want to verify it with the MAR that it's correct. We have the right patient.
Okay.
All 5 rights, right dose, right medication, right route, and right time, okay?
Okay.
All right. Bring this up. Can you tell me your full name and date of birth?
Marta Yarn 1127.
Okay, thank you. We want to go ahead and scan our medication. All right. And before we administer, we want to check for allergies, make sure everything's fine. Miss Yarn, do you have any allergies? I see you don't, correct?
No, I do not.
Okay, good. And when you scan twice, I always make sure I redo it and scan once. Okay, and that's correct.
Okay.
All right. We're going to be giving you, ask for the site. That's in her right hand. And what time we're giving it.
So you're going to document after you administer it?
Mm-hmm.
Okay.
Yeah, we want to make sure you have everything set up
Okay.
so you'll be okay, all right?
Okay.
So we're going to go ahead and get our tubing ready. Okay.
So what are you doing now, Heather?
Right now I'm preparing the tubing. I'm going to go ahead and spike it,
Okay.
the primary tubing. Make sure you're very careful with this because it is sterile, okay?
Okay.
Okay. Make sure you're clamped before you turn your medication. Otherwise you're going to have medication all over the floor.
Don't want that.
No. And we always want to pull some of the solution.
Okay.
Okay.
And are you priming it into the garbage or on the floor, or where do you prime it?
We like to prime it in the garbage. We don't want to make a mess.
Gotcha.
On the floor. Mm-hmm. So in this case, you'll bring your garbage can over. And the reason we're priming, we want to make sure we don't have any bubbles.
Gotcha.
I can occlude the line before we put it through, okay?
Mm-hmm.
Okay. So you just check for air.
Okay.
You see any, flick it out. Okay, it looks good. So I'm going to go ahead and clamp it. All right. So I'm going to go ahead and put this to hers. Get it all set up, okay?
Okay.
Always scrub the hub for 10 seconds, okay?
Okay.
You doing okay, Miss Yarn?
Yes.
All right. Okay. Got that attached there.
Okay.
All right. Let's go ahead and turn our pump on.
Are you going to put the tubing in there first? Or you
Mhm.
just said, okay.
It's asking if it's a new patient.
Mhm.
Just say no. It's the same patient, medical, surgical, yes. And we're going to go to our channel select, doing our IV fluid. We're giving our normal saline with potassium.
Mhm.
Yes, it's correct. And our rate, we're giving, let's see.
On the MAR, right?
Mm-hmm. Yeah, and you always want to, this is a good time too to check your medication, make sure it's correct. So we're going to be doing the 125 milliliters per hour, okay?
Okay.
And we're going to be infusing 1,000 milliliters. Okay, we're going to hit start. Make sure you unclamp. And it's going to check the line, make sure it's okay, all right?
Mm-hmm.
Do you have any questions yet?
No,
okay?
you're doing great.
All right. Okay, so I'm just going to double check the line, make sure it's okay. All right, everything looks good. I'm going to go ahead and unclamp it and start it, okay?
Mm-hmm.
You always want to check for 5 drops, make sure.
Okay.
Used to be 2, now we want 5, okay?
Mm-hmm.
All right. Now we're going to go ahead and document real quick before we administer the second.
Okay.
Okay, so we want to document what time we gave it. Hmm. We want to document just what we gave, make sure everything looks good.
Mm-hmm.
And our rate. And patient tolerated it fine. And our initials. And we hit save, make sure everything looks good. So now we're going to bring up and verify our gentamicin, okay?
Okay.
So I want to check.
The same things again on that expiration,
Yep,
the clarity, and all that.
expiration looks good.
Okay.
And she did say, Mr. Aaron, you said you had no allergies.
Right.
So, all right. Can I have your full name and date of birth one more time?
Marta Yan 1127.
Okay. And then we're going to scan our medication. All right, good. And we're going to go ahead and get this secondary up, okay?
Okay.
Okay. So we're gonna get our secondary tubing out.
Okay.
All right. I'm gonna go ahead and do the same thing.
Okay.
Take our caps off. Make sure the tip is sterile so it doesn't touch anything else. Okay.
Mm-hmm.
All right. Make sure we're clamped. Okay. And we always want to hang our medication higher.
Is this what the backflow thing is you were telling me about earlier?
Mm-hmm.
Okay.
So this is what you want it to look like overall. Okay.
Uh-huh.
All right. So I'm gonna go ahead and prime this first. Okay.
By the backflow, right?
Mm-hmm.
So you're going to connect it to the Y site on that guy?
Yep. First, we're going to do the same thing, same procedure. And the reason we want to backflow it, all right, we're going to go ahead and pause while we're getting it ready, okay?
Mm-hmm.
And the reason we want to backflow it is to,
Oh, wait, are you asking me this question? Is it so you don't get rid of extra medicine?
yes.
Okay.
We're going to go ahead and scrub the hub. Okay.
Getting quizzed. That's what a good nurse does, always questions the student, right?
Yep. Gotta do to you what they did to us. Alright, so now that we scrub the hub, we're going to attach it. Make sure it's on there good. Then we want to lower our medication. I'm going to unclamp till it starts to fill up a little bit, okay?
Mm-hmm.
Going about halfway, just like the other one. I'm going to clamp it back. Okay. I'm going to hang it up. And we're going to go ahead and program our secondary, okay?
Mm-hmm.
Alright, let's see.
Mm-hmm.
So we're going to go secondary.
Mm-hmm.
And we're looking for our Genta. And we're giving it every 8 hours.
Mm-hmm.
The rate 80 milligrams over 100 milliliters.
Mm-hmm.
Yes, it's correct. Make sure everything looks good. Make
Mm-hmm.
sure it matches with your MAR. It does. Next. Okay. Verify secondary clamp. And then we're going to start. Okay. And
Awesome.
again, we want to watch our drops, okay? Want to
Okay.
make sure before you leave the room, make sure everything's okay.
Perfect.
Miss Yarn, you doing okay?
Yes, thank you.
Good. So now we're going to go ahead and just document like we did the first one.
Okay.
So we're going to say what time we gave it. The rate, route, where we gave it at. We gave it 80 milligrams over 100 milliliters. And we also were going to be adding this to it. So what
Is that the tubing?
Here, yep, we're going to add this to the tubing. So we're going to write what day we started it at,
Mm-hmm.
the time, and then the date, which will be 96 hours from when we started it, and my initials. Okay?
Mm-hmm.
So I'm going to go ahead and set that up on the tubing here.
Okay.
Okay.
On both tubings, right?
Right. So I'm going to do it on this tubing,
And is it 72 or 96 hours?
96 hours.
Okay. Thank you.
Mm-hmm. We're going to do it again with the second, and our initials. So now everyone is on the same page, and patient did tolerate well. And Miss Yarn, I already did give you the teaching. You know your signs and symptoms of any.
Mm-hmm.
Okay, for the Genta. Good. All right. Okay, everything looks good. Do you have any questions for me?
No, thank you. Heather, thank you so much.
Sure. All right.